Hello ladies! For your convenience, I've put together all of my best breastfeeding videos to have my tips, experiences, knowledge and product recommendations all in one place. And if you're new here, I have exclusively breastfed 2 kids and have 3 years of breastfeeding between them. So get ready to take notes! Breastfeeding is natural, but does it come as natural as it seems? Not exactly. There is just a lot to breastfeeding. And in this video, I will share tips that I've learned during the last 9 months. Stay tuned because you want to know this. We had a rough start of our breastfeeding journey. Long story short, my full-term baby had troubles breathing on her own, wasn't able to breastfeed, and spent a few days in NICU. So I had to start my lactation on my own. I will share my mistakes so you can learn from them. Let's just start with the ones that I've learned recently. You better feed your baby in a few different positions because clogged milk ducts are no joke. And I will be honest with you girls, I was lazy in a way and I only breastfed her in a cradle position and laying down on the side because other positions I found to be not very comfortable. However, I knew that it's better to have her empty my breast from all the sides. Until last week, I was getting away with it, but a glass of wine I had between feedings was a trigger. Alcohol increases your supply, but decreases oxytocin, which controls your letdown. And as you know, a chain fails at its weakest link, and I got a little lump on the spot that gets drained the least. The spot was getting red and painful, and I started to breastfeed her in a football position, and the duct unclogged in 1 day. Now I will be switching between football, cradle, and laying down position, and hopefully this will help to drain my breast better. If this will ever happen to you, just pick a position in which your baby's chin will be pointed towards the lump, and this will help to drain that spot most effectively. The next tip is also something that I skipped on in the beginning, unfortunately. Burp your baby. Yes, breastfeeding process is not the same as bottle feeding, and we all know that while your baby eating from the bottle, he or she will definitely swallow some air, which will take space in their tummy, make them eat less and cause gases. And with breastfeeding, it shouldn't happen if the latch is right. And I knew that, and I didn't burp her while I should have. Either the latch was not always right, or maybe she was getting air when she was getting on and off me. But the advice is don't be lazy and stubborn like I was. Just get your baby in the upright position, rub her back and see if she burps or not. Better to spend a couple of minutes on this than have a fussy baby. Now, burping at night. When I realized that I better burp her, I got a question. What about nighttime? My baby falls asleep feeding laying down, and if I try to lift her, she will wake up. Well, apparently we shouldn't worry about it too much because babies eat slower at night and less likely to swallow air. However, if you are able to burp your baby without waking her up, do it. It's better. It's still possible when they are newborns. I didn't burp her at night and I still don't because here comes my next tip. Learn to feed laying down on the side. It's just so easy after you figure it out. You can rest with your baby. Feedings should not be exhausting. You should also try the biological feeding position when the baby is on top. This is what I did with her when she was a newborn. I swear, this made the biggest difference because getting up at night to feed her sitting down was a torture for me. I started to get sleep deprived, and at some point I felt a strong need to change something. I needed more rest. I wanted to be the best version of myself to take care of my baby while I wasn't myself at all. This is how we started to co-sleep little by little, and I have a whole video about it. But the thing is that you have to do what works best for your family. And if it is one of the safe forms of co-sleeping, go for it. Just follow the safety rules and do it. Don't think what people would say, because most of the breastfed babies after the sleep regression wake up about every 2 hours, sometimes even more often. So figure it out. Ask what works for your spouse, check what works for you and your baby, and do it. Another thing I want you to be mentally prepared for is that breastfeeding might be painful for you in the beginning. And of course I knew that, but I didn't expect for it to hurt for the whole month. Yes, that's what happened to me, but everybody is different, and I think it has something to do with the sensitivity of your skin in general. But just in case, get ready for that and know that it will pass, and stay strong because it's all worth it. Although, I want you to check for the correct latch first of all, and check for the tongue and lip tie. I wanted to make sure about it from the beginning, so I asked the doctor in the hospital to check her mouth. And I recommend you do the same, because if you get the lip tie and tongue tie out of the way, it's easier to determine what causes a bad latch and the pain along with it. Let me tell you about breastfeeding pillows. I thought that those will be all I need, but no. Stack up on a lot of different size pillows and have them next to the place where you will be breastfeeding the most, because you will probably need to adjust the height of your breastfeeding pillow by putting one more underneath of it, and you will probably want a pillow behind your back, and for the football position you will definitely want more pillows, so just keep that in mind. Test what you eat. We all know that there is no such a thing like a strict diet for breastfeeding mom, but I want you to test your food. And what I mean by that is just pay attention to what you eat and how your baby reacts. Is she more fussy? Is she more gassy? Her stool changed? Just identify what could cause the reaction and remove it from your diet. Usually it would be one of the 8 allergens, which is milk, dairy, eggs, fish, shellfish, tree nut, peanut, wheat, and soy. I quit dairy before having her, just in case, since it's the biggest allergen. However, sometimes some random foods can cause a reaction. For example, my baby gets gassy when I eat a lot of mushrooms. So ideally, it's better to test those 8 allergic foods one by one from the day 1 after you give birth, and to see if your baby gets a reaction, but also watch for some other foods too. Growth spurts. Once again, I have a whole separate video about how to get through them as quick as possible, but here I just want to say that you should really listen to me and forget about everything else but you and your baby as much as it's possible, and get cozy in the bed, because only skin to skin and constant cluster feeding will help you to get over with it as fast as possible. In this video, I will share what exactly did I do to go through my baby's growth spurts and keep on exclusively breastfeeding. Growth spurts are not easy. They are even harder to push through if you're exclusively breastfeeding. Growth spurts are critical for babies, as well as for moms. Unfortunately, many women start to supplement with formula during the time of growth spurts. Many even give up breastfeeding due to lack of knowledge and support. So keep watching to get informed and encouraged. What is a growth spurt? Well, in short, it's the point when your baby grows much faster than usual, almost like overnight. Accordingly, he or she will need more milk. And our body produces as much milk as our baby needs if you feed on demand. But it cannot react immediately. It needs a few days to accommodate and increase your milk supply. Babies know very well what to do in this situation. They want to be constantly on your breast to signal your body to produce more. When on the other hand, many moms do not know what to do, and they start to think that their baby is extremely hungry and they're not able to produce enough milk, and that's where the supplementing usually comes in. But in reality, growth spurt is a normal thing. You just need to stay calm and know how to push through it. All the babies go through the growth spurts, and all of them react differently. Some may be cluster feeding literally around the clock, when others can just have few extra feedings. It also depends on how good your supply was prior to that, if you fed on demand, and if you use a bottle or a pacifier. There are 4 growth spurts during the baby stage. Around 3 weeks mark, 6 weeks mark, 3 months, and 6 months. Our most noticeable growth spurts were at 3 weeks and 6 weeks. Michaela got really fussy, she was cluster feeding around the clock, she barely had any sleep, she didn't want to let me go. So I followed my lactation consultant tips, and it took us about 3 days to come back to normal and increase my supply. However, if I would have acted differently, it probably would take up to a week. So if you notice that your baby is getting extra fussy, wants to feed more often, and it's about time for a cross part, most importantly, you need to ensure that your baby has full access to you and your breast 24/7. You need to let your baby increase your supply by sucking as much as he or she needs. Next, you need to accept that your baby will be glued to you for the next few days. Just let it be. You need to stay calm, to don't interfere with your hormones, because being stressed can block your letdown, and then in this case, baby will definitely lack food. Get comfortable in the bed or a couch. Make sure you can get all the help you need from your partner. Explain to your family what your baby is going through and ask them for support. Have a lot of skin-to-skin contact. It helps to produce the right hormones to increase your supply. Also, make sure you don't use a pacifier and don't give your baby a bottle either with formula or with breast milk, because it will prolong this process. Switch sides for every new latch, even if it's been only a few minutes since your baby fed last time. And be confident, you got it, mama. Every next growth part was easier for us. Either it's just the way my baby handled it, or it was due to me staying calm, being mentally ready, and being confident. Get ready to hear all the things they don't tell you about breastfeeding. A little warning here, there are a lot of TMI stuff in this video. However, if you are about to become a first-time mom or a first-time breastfeeding mom, you have to hear this. And all of us, most of us, grew in the formula feeding world, and we had no example of breastfeeding. Our moms and grandmas, they just have no advice to share, unfortunately. I will share a few things mom don't talk about, because they seem like TMI, some of them are embarrassing, awkward, weird, and when new moms face things they have never heard about, they start feeling like there is something wrong with them, which brings stress, like taking care of a new baby is not enough. First things first, breastfeeding is not always peaceful and joyful. It will hurt at first, and they don't tell you about that, probably because most of the moms just forget about it, since nature tricks us and makes us forget this pain as well as the labor pain, so we actually can have more kids in future. But I think it's important to be prepared for this. So for me, it took about a month for breastfeeding to stop hurting, but in general I heard it takes less time. It really depends on how fast you will be able to teach your baby to latch correctly. So for me it took longer, since my baby spent a few days in NICU and she was given bottles and pacifiers, which probably made her nipple confused. And also I have been pumping around the clock during those few first days, and probably I was not using the right funnel size of the pump, and it made my breast be very sensitive. So I'm not sure what was the reason, but usually it takes maybe a week or so. And when I say breastfeeding hurts, for you to understand this, I was in tears every time she latched for at least first 2 weeks or so. Then it got gradually better, but it hurted that much. But like I said, maybe my case was an exception, but I want you to be ready for that. Also, there is such a thing as a lip tie and a tongue tie. Many moms have never heard of that, and it's a good thing to keep in mind, because this can actually impact the right latch. The baby won't be able to latch correctly and it will hurt you, the baby won't get milk. So in the hospital or whenever you see your pediatrician, ask her or him to check if your baby does not have a lip or tongue tie, so that you can actually exclude this issue and deal with the latch, not thinking about, oh, what if he or she has a lip or tongue tie, because that can be a serious issue. Next, engorgement. It happens when your milk comes in around second or third day after having a baby. Your breast become hard like a rock, and besides this uncomfortable feeling, this can actually make your baby not be able to eat, or make it harder for him or her to eat, which can cause clogged milk ducts and so on and so on. So you really don't want this to happen, but no one really tells new moms ahead of time that there are ways to avoid extreme engorgement, and I have a video where I shared what exactly did I do to minimize the engorgement, and it actually helped, and I really want you to watch this because every new mom should know this ahead of time. Another thing you need to know about and learn to embrace ahead of time is the changes with your nipples. Now, being pregnant, you probably noticed that your breast in general, your nipples started to change shape and color, and you need to be ready for them to keep changing. And knowing this will hopefully help you to get ready for it mentally and learn to embrace it and know that it's normal and everyone goes through it. The next thing they don't tell you about is a good chance of having one breast smaller than the other. You need to make sure that you feed your baby the same amount of time on both sides, and it is common for babies to have a favorite side because one breast might produce more milk, or maybe that breast has an easier letdown, so your baby doesn't have to work as hard on that side for milk to come out. But it's very important to kind of make your baby to eat on the other side as well. You cannot give up feeding on one side, and there are actually applications for that you can download where you can log in the time and the side, and then it calculates for you how many minutes exactly you fed on one side and on the other side for that day, so that you can even it out tomorrow. So make sure about that, because if you feed on one side more, it can cause a significant difference in size of your breasts. Then breastfed babies and sleep. I know it's a controversial topic, that's why I just want to share with you some facts that actually remain untold. So the first one is breastfed babies do wake up way more often usually than formula-fed babies. Their sleep is much lighter, and it takes usually much longer for them to start sleeping through the night. My 17-month-old does not sleep through the night still. So the second fact is that many moms, including me, breastfeeding moms, end up bed sharing with their babies, even if they did not anticipate doing it at first, because when your baby wakes up to 10 times a night, bed sharing is the only way to get some sleep and keep yourself sane. And the third thing is that bed sharing is safe, despite the common belief here in US. If you follow the safety rules, breastfeeding and bed sharing go hand in hand, and it is safe to co-sleep, to bed share, particularly with breastfed baby. Although, like I said, different things work for different families. It's a controversial topic. That's why before jumping into it, you need to talk to your partner, study all the guidelines, research all the benefits and risks of co-sleeping, and then make your informed choice. Also, no one tells you that breastfeeding laying down is the skill you want to master as soon as possible. This will actually help you to recover after giving birth as soon as possible. It's recommended to be resting in the horizontal position like about 2 weeks postpartum. Then it will also ease the pressure on your back from changing, picking up your baby and holding and feeding, all that stuff. And as I said, it will actually let you get some more sleep that you need. And there's another position called biological breastfeeding position, when the baby is on top of you. This position actually saved me from losing it at night when Michaela was a newborn. That was the first position from which I kind of started to bed share with her. If you want to know more about it, I also have a video about how we ended up bed sharing. One more thing about sleep and breastfeeding they don't tell you about is how important it can be sometimes to wake your baby up in time. Because if your baby happens to have too long of a sleep stretch at night, you might end up with clogged milk ducts, which are not fun on its own, but they also can lead to mastitis, which you will have to take some strong medication for. I'm not even talking about the pain and the fever it causes. So always have an alarm set around the time when your baby usually wakes up to avoid having this problem. Next, don't expect breastfeeding in public be easy, especially in the beginning for the first few months or so, because newborns they do need a lot of assistance, latching and positioning, and for that you need both hands and you want to see exactly what you're doing, and the nursing cover does not let you do it. So what I recommend you, ask someone, whoever is with you, to help you. Find a cozy corner and ask that person to hold that cover or a blanket or whatever just around you while you actually have your both hands and can see everything. And when your baby is already latched good and positioned good, then you can put the cover over you. Otherwise, and actually probably every time, whatever you do, anyways, first breastfeeding sessions in public are very stressful, uncomfortable, and awkward, so get ready for that. Another thing they don't tell you about is, as a breastfeeding mom, you won't be able to be very welcoming to your guests, to visitors who want to come and see new baby, simply because the newborn is glued to you and your breast almost like 24/7, and like I said, you will want your privacy. It's very uncomfortable to breastfeed in the beginning when you are covered up. So probably most of the time you and the baby will spend in a different room, and there is a chance that a guest who stopped by for half an hour or an hour might not even see or hold the baby, and you need to make sure to tell your family, your friends about it to avoid uncomfortable situations. Okay, now the topic that almost no moms talk about at all: breastfeeding and your sex drive. Yes, in fact, the change in hormones in many cases will significantly lower breastfeeding moms' libido, and many women don't know that it's common. Many women don't know that only when you're done breastfeeding, your normal drive will come back. They start looking for problems in their relationship, they question their love to their partner, and they start looking for some health issues they don't have. Instead of embracing it, being patient, explaining this side effect to their partner, and looking for temporary solutions and compromises. Besides lower libido, it's actually totally normal to experience dryness down there and either extra sensitive or not responsive breast. Also, there is this new term I like, being touched out, meaning a mom, and especially breastfeeding mom, for the whole day being constantly touched by a baby, and in the end of the day, when the baby is finally down for the longest sleep stretch, the mom just wants her space and does not want to be touched. This truly happens. So please remember that it's only temporary. You will feel like yourself again, and it's just another sacrifice moms have to make for their babies. And it's just like nature's way of making women concentrate on their new baby instead of getting pregnant again. It will pass and it will be all worth it. Remember, breastfeeding and motherhood in general is a mental game. Don't forget to take care of yourself, of your body, and of your mental state. Don't forget to give yourself grace and ask for help when you need it. I'll share how I managed to don't get my breast engorged. As you know, at first our breast produces colostrum. Then in about 3 days after birth, we have our milk coming in, and it happens very sudden. Our body doesn't know how much milk this baby needs, or maybe you had multiples, so it produces as much milk as it possibly can in the first 10 days. After that, if you feed on demand, your baby will regulate your milk supply according to his or her needs. So, if you do nothing about it, then most probably you will get engorged in the first days. And engorgement is not just very painful. Most importantly, being engorged doesn't let your baby to latch and eat, because your breast becomes as hard as a stone. However, there are ways to avoid engorgement. The first way is to stay on the lookout for your milk coming in, to start using this special expressing technique on time, meaning staying up all day and all night, because as I said, your milk can come in any second. You can decide to go for a half an hour nap and wake up already with huge and painful breast. The second way is to limit your liquids intake gradually. I did so. In the first 24 hours after birth, I had all the water, soups and teas I wanted, but the second 24 hours after birth, I limited myself to 1 liter or 34 ounces of liquid. The third day I only had 900 milliliters, which is about 30 ounces. Then it was 800, 700, 600 and 500 milliliters. After that, I started going backwards in these numbers, and by the day 10, I already was drinking all the water I wanted. Typically, at this point, engorgement won't happen. Also, you shouldn't take a hot shower and do not have any hot drinks. Apply cold to your breast between feedings if you still need some relief. I will leave the system on all these numbers in the description down below so you can take another look at it or take a screenshot. To tell you the truth, limiting my liquids was very hard. At some point I wanted to quit, but what stopped me was that feeling of milk coming in every time more and more when I take just one sip of water. Not being engorged doesn't mean feeling light and painless. Breastfeeding still hurts in the beginning, and I talk more about it in my postpartum video update. So my breast still had more than enough milk, it still hurt, it still was sensitive, and the thought of getting engorged was terrifying, especially because this would have made my baby not able to breastfeed, and this was extremely important to me. If you already watched my previous breastfeeding journey video, then you know that Michaela went through NICU. And in order for doctors to get her discharged, she had to be either bottle or breastfed for 24 hours straight. And breastfeeding is hard for a new mom. You and your baby are just learning everything about it. I was trying to get her latched correctly while tears were running down my face because of how unbelievably it hurt me. She got a bottle before my breast. That was the problem. She was sliding down to my nipple every time and it hurt horribly. Also, I think that pumping around the clock made my nipples even more sensitive. Nurses in NICU were doubting if I can do this. They saw in how much pain I was. Also, it was not clear for them how much the baby getting. My husband also felt bad for me, and he even asked, maybe we should let them give her a bottle just for them to see it clearly that she is sucking good, that she is getting enough, and just to get out of NICU as soon as we can. But I knew that this would make it even worse. I was trying to improve her latch. I was there for every feeding. I was taking that pain and smiling to nurses just to ensure them that we're doing just fine, because I knew it will get better. That's why it was so important for me to don't get engorged, because that would have been the beginning of the end of my breastfeeding. Nipple confusion is real, especially at a newborn stage. So I chose to limit my liquids, and it worked for me. We got out of NICU because she was exclusively breastfed for 24 hours straight and ever since. And if you will want to do this technique as well, I want to mention that you have to count all the liquids you have: soups, teas, juicy veggies or juicy fruits. Also, I want to mention that you shouldn't limit yourself more than 10 days. After that, you should drink plenty of water. Hi girls, I'm back with another breastfeeding topic, and today I'm going to tell you everything you need to know about switching sides while nursing. How often should I switch sides, you ask? Well, I wish I could tell you switch sides every hour or switch sides for every new feed, but it's a bit more complicated than that. That's why I'm dedicating a whole video to this question. So in a perfect world, every new mom should know this ahead of time when she's still pregnant, because it is that important. And I want to put a little disclaimer here. I'm not a breastfeeding specialist by any means, but what I will share with you today is what I've learned from my lactation consultant, what I have implemented in my own breastfeeding journey, and what have helped me successfully breastfeed until now, 17 months straight, and currently we are slowly moving toward weaning. So let's start from the beginning, from the first 14 days of your baby's life. That's the time when you're working on establishing your lactation, when your baby is constantly feeding to make you to produce milk, because at first you're gonna produce some colostrum, this thick golden liquid which is crucial for your baby's health. And then when your actual milk comes in, your baby will be working on regulating your supply, adjusting it to his or her needs. So for those 14 first days, you wanna switch sides for every new feed, even if it has been only a couple of minutes since the last time your baby fed. Then, by the day 15 of your baby's life, your milk will get divided on so-called foremilk and hindmilk. So foremilk is what your baby getting in the beginning of the feed. It has a lot of lactose, it's super sweet. And hindmilk is actually very nutrient-rich, fatty, full of calories, milk that actually feeds your baby. Although both of them are important, but the thing is, often the hind milk doesn't get to babies and they get too much of foremilk. So what happens if babies do not get enough or do not get at all hind milk? They might not be gaining enough weight, they're gonna be hungry and fussy, and you certainly don't want that. And what happens if they get too much of foremilk, and it's called lactose overload? Well, your baby will be gassy and fussy, will have some digestive problems, the stool will change, particularly green colored stool is a sign of the lactose overload. So to avoid both of these situations, what you're gonna do starting from day 15, you will feed on one side for at least 1.5 to 2 hours. It can be one feeding or it can be a few feedings, doesn't matter. I used to wear a hair tie on my wrist to track on which side I fed last, and it's very important to remember because you do want to feed the same amount of time on each side, because if you don't, you might end up having different size breasts and you don't want that, right? So if you will find it hard to track the sides yourself, there are plenty of baby tracking apps and most of them let you log the feed and the side. So starting from the day 15th, you should be feeding on each side from 1.5 to 2 hours, with one exception: growth spurts. I have a whole separate video about them. I explained what are the growth spurts, when do they happen, and how to survive them. I highly recommend you watching it, you will appreciate that information. But basically, when the growth spurt come around, you wanna come back to feeding on each side every feed. You switch sides for every new feed, and like I said, even if it has been only a few or even a couple of minutes since the last feed. Actually, there are about 4 of them in the baby stage, main growth spurts, but if you feed on demand and you respond to your baby's every cues, you might not even notice some of them. But if you do, generally you should go through them in about 3 to 4 days, so don't be scared, but it's better to be aware of them. Today I decided to sit down and share my thoughts and, most importantly, my experience with using a pacifier while breastfeeding. I realized that I haven't shared anything on this topic yet, and unfortunately there are no many videos talking about pacifiers and breastfed babies here on YouTube. While personally I would have loved to hear what I will tell you today back when I was pregnant, so hopefully this video will give some clarity and grace to those who are expecting mamas or new mamas out there, and will help you make an informed choice. This is what my channel is all about, right? When you're a breastfeeding mom, most probably your baby will be glued to you for the first couple of months. And it can be hard to handle sometimes, especially if you didn't see it coming, if you imagined your motherhood somewhat differently. A pacifier might seem like a good idea to make it a little easier on you, and sometimes it's truly a savior. But in the long term, a use of pacifier, a constant use of pacifier, can cause big troubles and end your breastfeeding journey much earlier than you anticipated. Some of you who are here with me from the very beginning of this channel might remember me saying very strongly that we will not use a pacifier at all. So first, let me share those reasons that made me have this mindset on pacifier, and then I will tell you what happened in reality. The first reason to avoid the use of pacifier is to avoid nipple confusion. Chances are you heard about this term before. It's really simple. The baby uses a completely different technique while sucking a pacifier or a bottle comparing to sucking a breast. And chances of getting a nipple confused baby are about 50%, which I consider pretty high for a woman who wants to exclusively breastfeed. Using a bottle or a pacifier is risky because 50% chance is a big chance. And I heard this example in a different YouTube video the other day. It's actually a very good video to watch if you want to go deeper in this topic. It's all about research on pacifiers. I will have it linked below. So the example is this. If, for instance, you want to learn to play baseball, will it be useful to use a football instead of baseball half of the time when you practice? Probably not. When you try to learn a new skill, you need to concentrate on this specific one skill for a while and don't get distracted with nothing else. And what do we concentrate the most during about first months of baby's life is to learn them to latch correctly on the breast. Second reason to avoid the use of pacifier is to establish a good milk supply, especially in the beginning, because the baby is the one who helps to regulate and adjust your milk supply. And if your baby is sucking on the pacifier half of the time, it will definitely mess with your supply. Well, most probably, I would say, because some women have like extra oversupply. Maybe for them it will be fine, but most probably you will get a problem, very common problem. I don't have enough milk, my baby is not gaining weight. Then what happens? You start supplementing with formula instead of eliminating the use of pacifier. Very common story. And then what we have? We have exclusively formula fed baby. And a little disclaimer here, I'm not against formula feeding whatsoever. Sometimes it's helpful, sometimes it's absolutely necessary, but this video is for women who want to exclusively breastfeed and breastfeed successfully for long term. Also, it is especially important to let your baby cluster feed as much as he or she wants to during growth spurts. And most of the new moms have no clue about what a growth spurt is and when it happens. And here is the deal. If you will try to introduce a pacifier to about a 2-month-old baby when your milk supply is established and the baby passed about 2 growth spurts, your baby, exclusively breastfed baby, will probably not take a pacifier. Here comes the most interesting part. What happened in reality, how my expectations went down the drain, my experience, my mistakes, and what I believe now after having a baby. Because Michaela spent a few days in NICU, she was introduced to a pacifier and a bottle before she first latched to my breast. Again, I have a couple of videos all about our NICU story, how I jump-started my lactation when she was not able to eat on her own, how we switched from supplementing with formula and using the bottle and the pacifier in NICU to exclusively breastfeeding. I will have those videos up here and in the description. So obviously everything went very unexpectedly, and I was really shocked with everything, going from no pacifier never to pacifier the first thing she had in her mouth. You know, it was really hard, but I was really strong after we got discharged, and I said no pacifier, no more, breast only. The problem was that she was already sucking breast like a pacifier. She was kind of nipple confused. My lactation consultant and I, we were working on improving her latch. It took us a long time. I was in so much pain. I knew that every time I would use a pacifier, it would take me a step back. But I came to realize that there are times in life when you absolutely need a pacifier. Car rides, first of all. Sometimes you get lucky and your newborn sleeps the whole ride. But what if your newborn is awake? He or she constantly wants to be held or nursed, neither of which is allowed in the car, because you just cannot take your newborn or a baby or a kid out of car seat while you're driving, or even if somebody else is driving and you're in the back, it's unsafe to take them out. And you're not always able to stop in the middle of highway, for example. What you gonna do? I don't know how it is in your country, but here in US, you go to the pediatrician's office every so often, I would say. When you have a newborn, it seems like you go very often, and especially if you're a doctor or you have any concerns. What if you don't have help and you absolutely have to go and buy groceries? Or what if you cannot avoid some other necessary trips? Or what if you just want to go somewhere anyways, because your mental state is very important too. It's really hard to stay for weeks at home with a newborn. After a few stressful trips, I gave up and I gave her a pacifier. She was about 3 weeks old, and this is the age when most of the doctors consider safe to introduce a pacifier, supposed to don't develop a nipple confusion. And you know what? This was the best decision I've made. One of the best decisions I've made in my motherhood. And back then, I did not think so. I felt so bad giving her a pacifier. I felt like a bad mom. And why I'm sharing all this with you? Because if you ever feel mom guilt, remember to give yourself grace. You are doing your best. I know that for sure. You are the best mom your baby could ever have. You are your baby's mom, and that's the most important thing. And like I said, give yourself grace. You have to do what you have to do. You are learning to live in this modern world with your new baby, with safety rules, with car seats, and the proper attention to mother's mental state. We started to use a pacifier only when necessary, only when there is absolutely no other choice, and it did not cause any problems, luckily, right? So here are some other situations besides car rides when I would give her pacifier. When I went to my first afterbirth doctor appointment and she stayed with my mom-in-law, when I went to a few dentist appointments and she stayed with my mom or my husband, and sometimes I would give her pacifier when we are out and about, maybe in the restaurant, for instance. Back then, I was not comfortable breastfeeding in public, mostly because I did not get a hang of it yet and she needed help to latch. It was just very uncomfortable in public. I would give her a pacifier to soothe her a little bit, and then as soon as we get to the car, I would nurse her there. When she passed a newborn stage, I was still using a pacifier sometimes in the car, or if I would want to have a glass of wine and needed to wait a certain time to breastfeed her again, but that did not work too long. At about 5 months of age, she did not suck on it anymore. She would play with it, bite on it maybe, but she did not get soothed by it, and it just no longer worked. This is a story of a new mom full of mom guilt, who was so scared to make any mistakes that ended up making one right away. A mistake of not giving a pacifier to her daughter earlier when she really needed it, when that was the only way to soothe her and don't put her through stress. So here is my conclusion. A pacifier is an absolutely necessary thing in nowadays world. Car rides, doctor visits, even going to do your nails. If it makes you feel better, why not, right? Sometimes a pacifier is the only way to go. And I used it only when absolutely necessary. That was always my last choice. The main thing is do not overdo it. I know it's tempting when you want to set yourself free from a cluster feeding baby, but remember all the risks I mentioned before. Be wise with it. So I will give a pacifier to my second baby as soon as it will be necessary. Even it means giving a pacifier in the first ride from hospital home, because I don't want to put another baby through stress that I did put Michaela at some point. Probably you want to increase your milk supply, or you might already have a good supply and want to maintain it. Either way, my tips will work for you. A little note, I won't talk about boosting your supply with certain foods, simply because there is no proof of any lactation cookies working. Any lactation specialist will tell you that. Instead, I will share things that really work. The first and the most important thing, which might sound rough, put aside all the pacifiers and bottles if you're using them. It's absolutely necessary if you're having a low supply or if your baby going through a growth spurt. Your breast needs as much stimulation as possible right now because breastfeeding is a supply and demand system. Just let your baby cluster feed or comfort nurse, whatever you want to call it, as much as he or she wants to. Using a pacifier or a bottle with breastfed babies is always risky for two reasons. One, it can lead to a nipple confusion, there is always a 50% chance of that. And two, it can drop your supply. So even if you're here just to be able to maintain your supply, keep that in mind. Don't use a pacifier unless it's absolutely necessary, for instance, in the car on a freeway. The next tip is flowing out of the first one. Breastfeed on demand. It might sound obvious for some of you, but not every mom knows what breastfeeding on demand really is. I'll be honest with you, I was not good at it at first. During the first few months when baby is glued to you, it's really tiring and sometimes you just want to take a long shower, do something for yourself while somebody else is with your baby. And then you come back to nurse only when your baby won't stop crying. I get it. However, breastfeeding when your baby is already crying is not breastfeeding on demand. You always need to look out for signs that baby gives you. For instance, when baby is stretching, it means she wants to nurse. When baby opens her mouth and moves her tongue, it means she wants to nurse. When sucking her lips, sucking her hand, doing some other sucking motions, all of those are baby's cues for nursing. As you probably know, a need to nurse does not always mean hunger. It can be a need to communicate with the mom, a need to feel safe, to relax, to calm down. Nursing has so many functions, and I know that it's almost impossible to respond to your baby's every cues, but we need to try our best because if we do, there won't be a problem with supply. Next, have skin-to-skin sessions. Get comfortable in a bed or couch, take off your shirt, take off your bra, undress your baby, leave just the diaper on, and cuddle. Smell your baby, kiss your baby, let her cluster feed, let her sleep on you, feed in the laid-back biological position. All of these things will help your supply because the right hormones will get released, the milk will get produced and will be delivered to your baby. If you are having a really low supply, you need to try to forget about everything for a few days, as much as it's possible, and get comfortable in the bed and nest with your baby. This will help. Try to stay calm and positive because being overwhelmed and stressed might impact your letdown and your baby won't get any milk. It's just hormones, very simple and logical. When you're stressed, the hormones of stress get released like cortisol and adrenaline, and they block the hormone oxytocin, which is hormone of love and attachment, and it's the hormone that is in charge of your letdown. Also consider co-sleeping. Statistics shows that mothers who bed share tend to breastfeed longer and maintain exclusive breastfeeding longer than those who don't co-sleep. Why is that? It's simply because you have your baby close to you the whole night and this helps your supply. And I know this is a sensitive topic, but I just want to say that there are different types of co-sleeping and there are some safe types. You just need to follow the safety rules. And I have a whole separate video about our experience, how and why we ended up bed sharing. I will have it linked up here and in the description below. Check it out after this video is done. Another thing you can do is to have an early morning feed, specifically somewhere from 3 in the morning to 5 in the morning, because this is the time when the hormone prolactin is the most active. And if you do feed during this time, you will be able to have a good supply. I currently don't worry about this timing because my 11-month-old wants to nurse every hour, starting from 4 in the morning till 8 in the morning, every single day pretty much. So when she was little though, and she was able to have 5, 6, even 7 hour sleep stretches, I had to make sure she's awake for the early morning feed. Sometimes I would even put my alarm and wake her up because this is that important. You can also drink hot fluids to boost your supply. There are a lot of lactation teas out there, and some moms say that they really help, but in reality, any hot liquid will boost your supply. That's why during those first few days after birth, when your milk comes in, you want to avoid drinking hot fluids to avoid engorgement. Just simple logic. If your baby is about 3 weeks, 6 weeks, 3 months, or 6 months old, and you having a drop in your supply, it's definitely associated with the growth spurt your baby is going through. I followed all those tips that I shared with you today, and I haven't had a problem with my supply. Even some growth spurts went unnoticed. In today's video, I want to share my reoccurring mastitis story, my mastitis journey, and what helped me to stop mastitis from coming back. And I have a boy who just turned 1, and with him I did have that reoccurring mastitis that was driving me crazy and influencing my life with a newborn so much. It was so hard. I'm gonna tell you a little bit of my story, my journey, antibiotics experiences, and tell you what was causing it, how I prevent it from coming back still, because I'm still breastfeeding. And here on my channel I post videos like this where I'm sharing my experiences in motherhood, and I share my ideas, tips and tricks to try and make parenthood a bit easier on you. So if this sounds like something you could get a value from, consider subscribing, hit the bell icon. I post every single Thursday and a bonus video here and there sometimes, so make sure to don't miss out on my new content going live. And now let me tell you, I did have like some clogged milk ducts with my first, so I kind of knew how it feels and what it is. But then when I had my second child, I started dealing with reoccurring clogged milk ducts, which is mastitis. When you get fever, it's already mastitis, and mastitis does not always equals you have to take antibiotics. So for me it was the last resource, and I ended up there. But first, you know, I tried everything else. I made sure I fed him in all different positions, so he emptied my breast all over the place. And then obviously I tried making sure my breasts don't overflow, you know, that they are not staying too full, and maybe I need to pump here and there for a little bit of relief, not completely, not to drain completely. And I was doing all that, and then I started pumping because I wanted to create a milk stash. So I was trying to you know, have this routine with pumping once a day. I wanted to make sure I can pump and save that milk, which, spoiler alert, my child does not like frozen milk. Yeah, right now he doesn't even like it in a bottle at all, just from the breast. Anyways, so that's what I was doing, and I kept getting this clogged milk ducts together with fever and redness and excruciating pain and all that stuff that mastitis comes with. So then I had my postnatal appointment. At that point I already went through 1 or 2 mastitis episodes that resolved on its own, but then there was one spot that kept coming back, like kept hurting. So you know, life with newborn is so hard. So I was just, I can't handle being sick, because when you have mastitis, fever and all that, you just feel like you're very sick and you have to take care of your newborn. And I also had my toddler with me home all the time. She didn't go to daycare back then. So I was like, what do you think? I asked my doctor, and she examined my breast, and she pushed on it so hard, like, you know, trying to unclog the duct or something. And she's like, yeah, I mean, I think we should do antibiotics. And I was like, I guess if that's gonna help, let's just do antibiotics, because I'm afraid that you know, it's coming back and everything. So you guys, if you never took antibiotics for mastitis, it's quite a pain. You take them either for 10 or 14 days, and you have to take them every 6 hours, so like 4 pills a day. So I had to like set my alarm to make sure I remember to take the pill, and also it has to be like 2 hours before food, 1 hour after food, something like that. So it's like complicated on top of all the other complications I have. So I'm like, okay, you know, I'm treating my mastitis, I'm not gonna feel bad anymore, and it's not gonna, you know, get worse. And you know, you Google and you read it, and you might end up having surgery if you don't treat it on time. And then whew, so I got scared, and I went with antibiotics, and it did not relieve my pain or my clogged milk duct right away. It did not. Like I was like a good week into taking my antibiotics, and I still was having that clogged duct in place. And I have a very funny accident happened, that basically by accident my husband like pushed me into my breast, and it was so painful. I screamed, I cried, because it was that spot. But you know what? After that, my clogged milk duct got unplugged. So basically, by accident, he unplugged my milk duct. And of course, I continued with my antibiotics, you know, but only after that it stopped hurting and stopped being red, and you know, the lump disappeared only after that push. The craziest thing is that the day I took my last antibiotic pill, my other side got mastitis. My other side started hurting, and I think it was really like quick and fast, like right away mastitis, right away fever, like from nowhere. So I called the doctor, and all they were able to tell me is, we sent refill to your pharmacy, take another course of the antibiotics. And I was like, no, I'm not taking them anymore. Like, my body just gave birth, nourishing a child, going through all of this mastitis, fever, sleepless nights. Like, I can't do this to my body. So I started looking into, you know, more things, what you can do about it. And honestly, that one just resolved on its own pretty much. I just kept doing the same thing, like constantly feeding there, making sure that child's chin is pointing towards the lamp. And yes, it's super painful, but it worked. Luckily, I got an advice from a lactation consultant who told me that there is some data proving that sunflower lecithin, that everybody talks about, does help to prevent clogging and also helps you to resolve those clogged milk ducts. So she gave me like a very basic recommendation of 2 capsules of sunflower lecithin, 1200 milligrams per day, and then the day if I feel like there is some clogging happening, or I already have some clogged duct, take 4 of those capsules of 1200 milligrams each. It just like changes like a texture of your milk. I guess this time around, for my big boy, my milk was really like fatty and thick, and maybe that contributed to a lot of clogging. So sunflower lecithin supposedly makes it like smoother and does not change like nutrition of it. It does not change what goes in it, anything like that. It's the same milk, it's just like thinner, like if you think about melted coconut oil. So that's how it works. It makes so much sense. Another very important thing that contributed to this is the fact that the lactation consultant I spoke to, she asked me if I'm pumping, and as I told you, I was. Apparently it can be a traumatic process to your nipples, and it can create like very teeny tiny, you know, scratches, cracks, whatever. An infection can get in easily. So she told me to stop pumping and try to, at least if I can, and I was able to. Luckily I was able to do that, and I stopped. I think I pumped after that only here and there a couple of times throughout this past year, just to leave some milk when I had to go somewhere for a little bit. In the beginning he was taking bottle with my milk. In the last couple of months he didn't, and that's it. These 2 things contributed to the fact that I stopped my mastitis from coming back. I started taking sunflower lecithin on daily basis, and I stopped pumping. Or I guess if you do have to continue pumping, you have to be gentle, careful, and make sure you have the right size flanges so that pump does not hurt your breast. Because mama, if you're going through this, I feel you. If you can, try everything and anything before you go the antibiotic route. Not a medical advice, obviously, just a recommendation from a mom. Look into it more. This is my experience, and hopefully this was helpful. I have a little one who just woke up. Definitely talk to your doctor, your lactation consultant, but from what I know, taking sunflower lecithin from day 1 is beneficial and can prevent you from going through this horrible thing as mastitis. We're told that breast milk has no vitamin D and we have to give our babies a supplement. Well, that's not exactly right. So in this video, I want to go over a couple of ways you can make sure that your baby gets enough of vitamin D. So a couple of years ago, when my first daughter Michaela was an infant, I shared my very sad experience with one of the vitamin D drops to help other parents don't make the same mistake. I was given that supplement in a pediatrician's office and my baby had a horrible reaction to it. I will leave that video up here and in the description below for you. Watch it after this video is done. And after that, I started wondering a lot about vitamin D and breast milk and what is the best vitamin D to give my baby. Do they even need vitamin D? So in this video, I just want to share a few things that I've learned along the way about breast milk and supplement babies and moms. So the first thing I want to say is that breast milk has vitamin D when the mom is not deficient. So let's start from the beginning. Vitamin D is vital. It's super important. If the baby is deficient on vitamin D, it's bad news. It can lead to some very serious troubles and problems. The recommendation to give all the babies 400 international units of vitamin D every day as a supplement are for like an average person, and to be more particular, for an average American mom who eats average American diet. So because our lifestyle has changed and as humans we don't spend as much time outside and we don't get enough exposure to the sun, especially in the northern states, because we do put lots of sunscreen. And when we talk about diet, average American diet does not have lots of vitamin D, even though there are fortified foods like milk and even orange juice and like oatmeals and cereals, I think in America are fortified with vitamin D. It's still not enough, and most of the American moms are deficient in vitamin D, meaning they can't extract it in their milk. So there are two different ways you can make sure your baby gets that vitamin D. Well, first, you indeed can give your baby a supplement because most probably you are deficient, but we don't know that, right? So there are ways you could find out, are you deficient or not? There are tests that could be done even at home, and you could ask your physician to order a test for you. But unfortunately, it's not a common thing, and even though vitamin D is very important for not just babies, but for us adults and moms, breastfeeding moms who are given so many minerals and vitamins out to the baby, most of us don't even know our levels. Apparently, this is not a routine thing to check your vitamin D. So because of that, pediatricians usually recommend giving your baby a supplement. Although, if you think about it, mom needs supplement of vitamin D too. So there are two ways to go about it. You can just give your baby a supplement, the recommended dose, or you yourself can take 6,400 international units of vitamin D supplements so that you can produce enough vitamin D in your milk. There was a study that proved that this is the case, but also if you live in a sunny state, as I do, for example, I live in South Carolina, I do try to get outside, although it still does not mean that I get enough of vitamin D because there have to be like a certain angle of the sun touching your skin and stuff like that. And my skin tone is lighter, so that means my skin is able to take more of vitamin D. I don't know if I'm deficient. I would guess that I'm not terribly deficient because of those two things that I just mentioned, but I do try to replenish my body with vitamins. I do take regular prenatal vitamins. I will leave the ones I take down below, but also I try to get my vitamin D from foods. And the best way to get vitamin D is eating fish such as salmon, sardines, which I like. Apparently, it's not a thing in America, but where I'm from, most of the people eat sardines, canned sardines. Well, in America, I see that lots of people like canned tuna. Some of the smaller tunas that are lower in mercury are better, like chunk light or skipjack tunas. They also have lots of vitamin D. Also, salmon can be cooked in different ways if you are not a fan. Also, egg yolks have a ton of vitamin D. So all of those foods, if you eat enough of them, let's say if you eat 2 servings of fish a week, should be enough to have normal levels of vitamin D. Also, if you go outside and if you do have lighter skin tone. But if you're a breastfeeding mom, like I said, if you are not doing a test, are you deficient or not, it's better to stay on the safe side and do give your baby a supplement. Of course, discuss this with your pediatrician before. Don't take my words as an advice. Ask your baby's doctor. But also the other way to go about it is either get tested or yourself. You could just take a supplement of 6,400 IU, international units of vitamin D, and the study says that you should be good to go. Your body will be producing that amount of vitamin D in the milk that your baby needs. And if you're curious how to pick the best vitamin D for your baby, I have a video about it. I share also which particular vitamin D I give to my babies, and both of them had a great reaction, which is no reaction to this product. I will leave that video down below and up here. Check it out after this video is done. I personally apply 1 drop of my vitamin D on my breast when I feed him. It's hard to keep up with it, honestly, especially when you're a mom of 2. So that's why, because sometimes I forget to give it to him daily, I do try to keep my body replenished with vitamin D so that maybe my milk has some as well to make up for those days that I forget. But also when your baby grows, you can continue applying these vitamin D drops on their foods if it's easier and better for you. Just 1 drop until they're like 1 year old. After that, I think the dose can be increased. Also talk to your pediatrician about that. But this is it. Your breast milk can have vitamin D if you're not deficient, but most of us are, so make sure to give your baby a good vitamin D supplement. And don't forget about your own health. We do need to take care of our bodies for ourselves and to make sure we are giving a very good nutrition to our babies. I'll tell you about products I've been loving as well as products I wish I'd had, so you can get armed up for your comfortable breastfeeding experience. So let's just start with a gel pack. This thing will come in handy in the first weeks after birth, because when your milk comes in, your breast becomes sore and swollen. Also, you can get engorged, which is not just very painful condition. Being engorged doesn't let your baby latch and eat because your breast becomes very hard. And if you're about to have a baby, I encourage you to watch my video where I shared the trick to how to avoid engorgement, and I will link it on top here and in the description down below. Make sure to check it out because that trick certainly saved me. So applying cold will give you relief in both situations, because not being engorged doesn't mean feeling light and painless. Your breast still becomes very sore during the first 2 weeks or even a month after birth, until your tissues will get used to the constant pressure and until your baby will regulate your milk supply. Now, you don't have to have a gel pack. You can just use ice cubes wrapped into a towel. However, never apply ice directly. So the gel pack will be more convenient option, especially if you will need some relief right in the hospital. Also, a nice thing I saw online recently is gel packs from Lancino. They are designed specifically for your breast. There are 2 of them in the pack, so you can treat both sides at the same time, which is awesome. And the shape of it looks like it's much more convenient to apply, so I will definitely consider buying them with my next baby. Another thing I wish I'd had and will definitely consider buying next time around is a manual silicone breast pump and milk saver. I could have used it so many times, especially in the beginning, and that thing could have saved me so much milk and helped to stock up my freezer without the need to pump. So especially during the first months, I had let down on both sides, and I could have just stick it to my other side while I fed and have some extra milk, because all that good stuff just soaked up into my breast pads and went to waste. And as you might have guessed, my next breastfeeding essential are breast pads. And even if you will have that milk saver, you will still need these. I went through tons of them and still I use them. Even 5 months later, I still leak. I cannot compare this leakage to the ones that I had previously. However, it is still annoying. And I know there are reusable breast pads out there. However, I don't see myself washing breast pads every day. As new moms, who has the time? I personally struggle with time management. So I really have been enjoying these disposable breast pads, and I recommend you to stock up on this ahead of time. The next product is a nursing pillow. I have two, this baby pillow and my breastfed pillow. In the beginning, I was using this one. Why? Because it supported my back, it has a snap, and it doesn't slip away. Also, it felt like it is more suitable for smaller babies, in my opinion. I was so glad I brought it with me to the hospital, and I will link on top here and in the description down below the video where I showed everything I actually used from my hospital bag, and if you're about to have a baby, it will be very helpful to you, so make sure to watch it. So when Michaela turned about 3 months old, I started to use this baby pillow just because she became longer and she started to fit much better on this one than on the other. Also, I want to mention something that I wish I'd known. So if you're someone who has a smaller breast, this pillow or any other pillow won't be enough. You will want some layer of other pillows under it, just because your baby won't be close enough to your breast if you don't put anything under. So make sure to keep on the side with you always some extra pillows so you can make yourself comfortable. Another thing that became essential for me because of our special circumstances is a breast pump. If you have been watching my channel, then you know that Michaela went to NICU for about 5 days and I had to start my lactation using a pump. However, even if everything runs smoothly for you since the beginning, and even if you're a stay-at-home mom, eventually you will need to pump. For example, I had a few dentist appointments when she was about 3 months old, or maybe you will want to have a date night with your spouse, so you will have to be out of the house for longer. Who knows, right? So it is always better to have some milk saved. And maybe if you'll just purchase that manual silicone breast pump, it will be enough for you if you pump occasionally, like me. So if I were you, I would just get that one, and later I'll see if I will need a pricier electric one. This is a single electric breast pump. They gave it to me in NICU, which I'm very grateful for, and it really doesn't bother me to pump one side at a time because I do it occasionally. And it is very important to pick the right size of a funnel, and I will leave the link down below to the guide how to measure yourself and how to pick the right size of this. Then you need to store your milk. I don't pump a lot, so I use these bottles that I got from NICU. And a lot of moms use plastic milk storage bags because they just take less space in your freezer. And along with storage bags and shields for your pump, you should get nipple cream. This is Medella's sample, and this is an organic nipple cream from Mother Love. I've been using this a lot in NICU because I've been pumping around the clock. Regardless of you pumping or not pumping at all, you should stock up on some good nipple cream, because during the first weeks, as I mentioned, your nipples will be sore and you will definitely enjoy some relief. Also keep in mind that you will not have time to wash off your nipple cream, so make sure it says that it is safe for your baby and you do not have to wash it off. The next breastfeeding essential is a nursing bra. This one is from Motherhood Maternity. It is wireless cotton nursing bra, and I have 3 of them and I love them. I'm using them day and night, and it might look a little tired from how many times I washed it in the past 5 months. However, I still use it and I enjoy them a lot. But you might think it's a night bra. Well, that's what I said in the beginning, and I purchased this nice wire bra. And guess what? I have never worn it since I had a baby. Yes, it is nursing bra and it looks very beautiful. I love the color. However, it is very uncomfortable to feed a baby in a wire bra. It also feels very uncomfortable have it on, and most importantly, it can cause clogged milk ducts, and you don't want that. So I think this been working for me very well. I just throw some breast pads on and they look pretty nice under any clothing. So I will recommend you to get just cotton nursing bras and no wire bras. Also, you will need something to cover while feeding in public and something to clean an aftermath, such as spills, leaks and burps. There are tons of nursing covers out there, but I've been loving this breathable and soft muslin blanket. Also, I've been loving this thick burp cloth to clean all the milk mass at home. And the last breastfeeding essential, but a very important one, which is technically a service, not a product, is a breastfeeding class. It definitely worth investing in a good lactation class, especially if you're a new mom, because there are so much to learn about it. Another important thing to do is to invite a lactation consultant to see you in your hospital, or if you had home births, to see you at home in the first 48 hours, I would say, because even if you're an experienced mom, there are things that can vary from baby to baby and can be spotted only by a specialist. For example, tongue tie or lip tie, and if those things will go unspotted, it can become a big problem. And today we're gonna talk about your cycle, period, and breastfeeding. This is a topic not everybody talks about. This is a topic you can just casually ask your mom friend about, and I made a video like that my first time around, first time postpartum with my daughter. Now I'm 8 months postpartum with my son, and I already had 2 cycles, and I'm ready to share my experience because last time it was very helpful to so many of you. I received so many comments. Let's start with the fact that, in case you don't know, breastfeeding on your period is safe. Okay, let's get this out of the way, just because I know that it can be confusing and it can be a question. In case this is your first baby, it's your maybe first time breastfeeding and getting your cycle back. For all of my new subscribers who haven't seen my previous video and who were going through the second pregnancy with me together, this time of postpartum can be very uncertain and kind of tough mentally, despite the fact, like I said, it's safe to breastfeed. You may experience some changes in breastfeeding patterns, in supply and your baby's behavior. So in case you haven't experienced those yet, I want you to know and want you to be aware that this can be the case when you get your cycle back, or in case you are going through these things, I want you to know that it's totally normal and maybe give you some ways to fix it. So first of all, some women experience lower supply when they are on their first few days of their period. Some women experience lower supply in the middle of their cycle. So again, totally normal. Your baby can be a little fussy and maybe wanting to cluster feed and nurse maybe more often and things like that. So that can definitely be linked to your period and the time of your cycle. Very different for every woman and even different from baby to baby, and I'll tell you my experience later. So I have a video on how to increase your milk supply, which applies usually to the times when your baby is going through growth spurts, but also those tips can help when you're experiencing a real dip in your supply. Although again, from what I know, and yes, I'm not an expert, I'm not a lactation consultant, but I dove very deep in this topic, and it's my second baby, breastfeeding my second baby. I breastfed for almost 2 years my first one, so I know quite a lot about it. So anyways, sometimes you just have to ride this wave and wait until this time passes and your supply is back to normal. So yeah, it's just part of the process sometimes, but you can always try, right? So I'll leave that video down below. You can always try to increase your supply, but anyways, this can happen. Another thing that can happen on your period, your nipples can get sore. Yes, that's right, just like in the very beginning of your breastfeeding journey, and sometimes it's very annoying and very uncomfortable. Again, it is what it is. I just hope you know that it's linked to your period, and you know, just wishing you patience, and it doesn't have to happen to you, but in case it does, you know why it's happening. So another thing I wanted to make sure you also know, and this is like the biggest thing you guys, or not you, maybe somebody who already watched my previous video, other moms were very happy to hear, cycles postpartum are irregular for the most part, very irregular, and it's so confusing and so uncertain, especially if you are not using any kind of hormonal birth control, if you're doing natural family planning and things like that. And another thing I want to mention, just in case, breastfeeding is not a form of birth control. In case you did not get your postpartum period just yet and you're exclusively breastfeeding, your ovulation comes before your first period, so you can potentially get pregnant. So please don't use breastfeeding as a form of birth control, even in the beginning, because some women get their periods back as early as 6 weeks postpartum. So let's get into my story this time around. I got my first period, which means my ovulation happened before that, about 2 weeks before that, right? When my child was still 6 months old, although he will turn 7 months in just a few days. So technically still 6 months postpartum, I got my period. Comparing to my first postpartum experience with my daughter, I got my first period when I was 8 months postpartum. And I think I know why it happened like that, because my daughter started solids much later than my son did. In case you're new here, my son started solids at 4 months of age, and he is having a great appetite. He's a big baby, and at 6 months old he was eating probably as much as Michaela was eating when she was 8 months old. So that makes a lot of sense. When kids start eating more solids, you breastfeed them a little less. Plus, Leonardo is not that interested in nursing all day long like Michaela used to be. So yeah, usually, again, from what I know, for the most part, women get their periods back when kids start solids and when they, you know, eat good portions already. So maybe like 2 months into starting solids. So just a little tip for you, a little timeline in case you are waiting for a period to start. So yeah, my period came back at 6 months postpartum. It was a normal period, meaning it was a normal amount of blood, which is, you know, if you're watching this, I guess you understand this is gonna be a TMI video, and I hope you're okay with that. I hope this is helpful, because my previous video was. So I'm just gonna keep sharing. I'm fine with sharing this because I know a lot of people need it. So it was a normal period for me, but the only part that was not normal, and I'm so grateful for it, it was absolutely painless. I was feeling great. I did not feel like I was having my period at all, like at all. I was having lots of back cramping before my period for weeks, so I knew something was happening, but during my period I didn't even feel I was having my period. I used to have painful and very painful periods. I heard that a lot of women have like extremely painful periods to the point where they you know, have to go to the doctor, and sometimes they even call ambulance. Luckily it was not that crazy, but I would take painkillers quite often, yeah, it was hard, especially when it's like a change of season, change of weather. A few times a year I would have very rough periods. So my first cycle postpartum with baby Leonardo was extremely nice, and I was like, I didn't want to jinx it. I was like, okay, it's just the first one. It would be nice if the pattern continues. And then my second cycle comes, and here is the important part. It took 37 days. My cycle was 37 days. I got my second period in 37 days after having my first. And usually it's very hard to wait, especially like I said, if you don't do any hormonal birth control, you are wondering, what if you're pregnant? Where is your cycle? Especially, you know, if it's late. Because usually my cycles are 30, 28 days, 29 days. I was never the kind of person who knows to the second when her cycle comes. Again, I heard women who are like, I always know, it's like a clockwork, it's always there on time. If it's 1 minute late, I know something is wrong. So it was not always like this for me, but this second time around I knew it's gonna be the case, because my first time around it took my second period 42 days to come, and it was quite stressful. But this time I was relaxed because I knew I was safe and nothing can be wrong. It's normal part of postpartum to have irregular periods. With my first daughter, until I got pregnant with my second, I was having pretty irregular periods for a long time. They started getting a little more regular, but I never got to the point in the course of like a year. I did not get to the point where they would be regular. So it might take quite some time. So stay calm, patient, and I want to give you a little tip and advice, and maybe like be the person who tells you just do it. Because a lot of women in that previous video were asking like, what should I do? It's been 10 days, I'm late. I've always said, if you're worried and you're postpartum and your period is irregular and you don't know what if you can be pregnant, even if you were safe but you're worried, just take the test. And better take 2 tests, better 2 different tests, just to be on the safe side, because as soon as you take those tests, you'll know, okay, it's all good, just stay calm, live your life, and your period will come. I don't know for how long it's normal for your period to be irregular. Ask your doctor. I know that you will be scheduling, you know, your annual checkup with your OBGYN after you've seen him or her. When you had the baby, you know, you have your postpartum checkup at like 4 weeks or 6 weeks, and then they will ask you to come back for an annual. So definitely by the time maybe you have a period or 2, ask them for how long it's okay for me to have those irregular periods. When should I be concerned? Because I never got to that point, so I don't know that. But for me, for years they were irregular. The most irregular time was in the beginning, my first, second and third periods. And oh yeah, my second period was also pretty much painless. Only in the beginning I had that weird feeling of, you know, like when there's a lot of blood flow going down there, you feel like there's a lot of tension and just like very uncomfortable feeling for a few minutes here and there in the very beginning. But then after that, no cramping. Not even like, you know, little feelings of heaviness in my stomach or bloating, nothing like that. Maybe very little, because I don't even notice, because again I compare it to how it used to be. So if this is gonna be the case, I don't know what baby Leonardo did there in my womb that it's no longer giving me this pain. I hope it stays this way, because it's a blessing. If you're a woman who used to have painful periods, now I'm telling you, there is hope. There is hope that your baby is gonna do some magic in there, and then you're gonna be pain-free for at least some time. Okay, maybe I'll update you on that in a year or so. So I'm very excited about that, because that was really influencing quality of my life. Mood-wise, I would say that I felt a little bit of mood swings before my period, but not sure if that was connected to my period, because I was going through some other things. With Leonardo, I did not notice any changes in his feeding pattern. I did not notice a dip in my supply. Maybe my nipples were a little sore here and there, maybe. Again, not very noticeable. So I feel very blessed and grateful for this. It can be totally different for you. So I hope this information helps you, it's good to know this because it can be so confusing. This is not something your OBGYN tells you, this is not something your pediatrician tells you. Where do you find information about it? On YouTube, here, right? So yeah, another thing I haven't talked about in that video, having your period back helps you a lot with your sex drive. If you're still listening, I'm sure you're a mom who's breastfeeding, and I'm also pretty sure that you've experienced feeling not like yourself, because breastfeeding hormones do make you feel like you're just a mom and nothing else. So it was really nice to feel like a woman again, kind of, not fully, not completely, but I do feel surge of these hormones, especially around ovulation time. Again, because my periods are irregular, I don't really know when ovulation is happening. Anyways, my body is trying to ovulate around some time, and I do feel like myself. I do have some kind of sex drive, because it was absolutely gone for a long time. The same was with Michaela, and if you know, I got pregnant when I was still breastfeeding Michaela, so I never actually got myself back. I've never actually felt totally myself again. And yes, I know, like, it's not about bouncing back, you're not the same person as you used to be, but I'm talking about just these hormones that's supposed to come back to normal, and if they don't, when you stop breastfeeding, it actually can be an issue and you should see your doctor. So I'm patiently waiting to be done breastfeeding this time and see how I'm gonna feel, if I'm gonna be feeling myself again, and if I'm gonna feel attractive again, and all these things. So yeah, if you are comfortable sharing your story, your journey, I'm sure this will be very helpful for other women. Leave your comments, leave your stories down below. Tell us when you got your period, tell us maybe some challenges you had when you got them with breastfeeding. Maybe I didn't say something, maybe I didn't know about some other things that can happen when you get your period and how your baby behaves, or maybe there's something else women need to know. Please leave it in the comments below. Also share for me, even because I'm very curious about your sex drive. When did it come back? If you're already done breastfeeding, did it come back right away? And when did you feel yourself again? Thank you so much for being here for this little girl talk. I hope this was helpful. If you have any questions I may be able to answer, leave them in the comments below. Remember that breastfeeding on your period is normal. Remember that breastfeeding is not a form of birth control. And remember that you just need to be patient, and if you're concerned, just take a pregnancy test. Be careful if you don't want to be pregnant again, and yeah, eventually your periods will become more regular and it's all gonna be okay.